Good evening, everybody. I'm Dr. Chirag Bhandari, and I'm an andrologist, and I would like to present my experience on penile enlargements. It's a very taboo topic in Indian context, but since last 5 years, I've been practicing penile enlargements, and it's been a great journey so far. I've had quite a lot of successful patients, and I'm presenting this topic because I want to share my knowledge and my experience with you, so that if such patients come to you, and we all know that we have these kind of patients in our practice, so if you have these kind of patients, you can always and always give them an option instead of just counseling them and telling them that's okay, your whatever sizes you have, it's normal. You can always give them options. So let's start. What is penile augmentation? It refers to enhancement of penis size, either length or girth or both, also called as augmentation penoplasty or augmentation phalloplasty. How do I justify for penile augmentation? So first is socio-cultural aspects. Across ages and almost everywhere in the world, we have seen that the men have grown up seeing a lot of images of sculptures or figures in the textbook of having large penises. So this kind of information has been passed down to them, to these men, that it is good to have a larger size. Then another aspect is the psychological aspects. Many patients are distressed about this for their for a long period of their life, and they don't have confidence to perform sexually with their partner. Because of lack of confidence, they fail to approach the partner, or they also have failure in their relationships. So most of these patients are treated conservatively, as I was saying, that instead of giving them an option of, instead of telling them that it's okay to have this size, it's normal, whatever you have, God has given, be happy with it. You can always tell them that, there are some methods of augmentation which are absolutely safe and effective. Then this is a very strong point. Why females undergo cosmetic enhancement? If females can undergo cosmetic enhancement, why can't males undergo cosmetic enhancement of their intimate parts? So this is another justification, a very strong justification. If the females are undergoing breast augmentation or hip augmentation or lip augmentation, then why can't males also have intimate parts augmented? And then, of course, we all know in our practice that there is a very high demand of penile augmentation, not only in Indian context, but in all across the world. So what are the indications for penile augmentation? One of the most common indications which we see, which we come across, are buried penis or excessive suprapubic fat, in which the penis is hidden inside the fat, inside the suprapubic fat, and because of which the perceived length or the girth is less, and makes patient anxious about his size. Then there are other congenital or acquired disorders like epispadias and hypospadias. Then penile shortening due to penile cancer, trauma, excessive skin loss, prostate cancer treatment, and Peyronie's disease. Peyronie's disease is a very common condition affecting men in middle age, and many of these patients, they come with the complaints that the penis is shrunken in the last few months or few years, and because of which their confidence has gone down. Then the most common indication is the cosmetic purposes. We have to rule out any psychiatric abnormalities like penile dysmorphophobia. So according to my experience, so this is a talk about my 5-year experience of penile augmentation. In my experience, length cannot be increased. Only the girth can be increased. So if the patient comes and tells you that he wants the length increased, then you can counsel the patient that there are absolutely no surgical or non-surgical methods of improving the length. But yes, girth can be definitely increased safely and effectively. One of the most commonly performed procedures in the earlier days was dermofat graft, which consists of all layers of skin and subcutaneous tissue after the removal of epidermis. The graft is placed between the dartos and the buccal fascia, and the volume has to be at least 20 to 30% more than the recipient size. But it can result in post-operative edema, infection, skin necrosis, seroma, and graft reabsorption can occur up to 20 to 30% 20 to 30% times. So the girth augmentation is about 40%. The length is by 25%, but that is again the flaccid length, not the erect length. But in my experience with what we have done, and as per people who have done this across the world, the length increase is very minimal. Only the girth enhancement is significant. This is a diagrammatic representation of how the autologous dermofat graft is placed. Now the another one is very commonly performed technique even in today's era, which is girth augmentation by autologous fat transfer, which means the liposuction of the suprapubic fat or the thigh fat, and then we centrifuge the fat and inject the fat into the between the dartos and the buccal layer. So the increase in girth is about 2 to 3 centimeters. Approximately 30 to 50 cc of the fat is injected. Most common problem or complication with this is nodule formation and fat migration. Again, the fat reabsorption can occur within 2 to 6 months, and that is up to 50 to 60%. This is one before and after picture of the autologous fat transfer in my earlier days, when I realized that this is not a very successful treatment option for the patient. There is a considerable increase in the size, but again the size goes back to its normal or up to 50 to 60% within 2 to 3 months. Now this is the most commonly performed procedure across the world by girth enhancement by HA filler or hyaluronic acid filler. And most of the doctors, most of the surgeons who are practicing penile augmentation, they are using HA fillers in their practice. HA filler is considered to be very safe. HA filler is used in all the other body transformations, like for the cheek, for the lips, for the buttocks, for the breast, and it's very, very safe. It's an ideal filling material because it is biocompatible, non-antigenic, non-pyrogenic, non-toxic, and non-inflammatory. It is very easy to use, stable after injection, long-lasting, reabsorbable, and natural looking. Also, the most important aspect of using HA filler is that it is reversible. If the patient doesn't like, or if there is any lump formation or nodule formation, you can just reverse the whole procedure within few hours. Approximately 15 to 20 cc is injected. Earlier, I used to inject about 15 to 20 cc in one sitting. Now, as per my learnings from these patients, I advise the patient to come in 2 sittings. So I inject about 10 to 12 cc in the first sitting, and then rest about 6 to 8 cc in the next sitting, that is after 1 month. So in that case, the chances of lump formation are less. Also, if already a lump has formed because of the previous filler injection, you can remove that lump by injection of Hyalase, and you can inject the more filler into between the dartos and the buccal fascia. Back and forth technique, and cannula is injected at the 11 and 12 o'clock position to avoid injury to the dorsal pedicle. Then you use a roller to distribute the HA filler. The girth increase can be approximately 2 to 4 centimeters and length by 0.5 to 1.5 centimeter, which is again non-significant. Reabsorption, most of the fillers, they get reabsorbed by 50 to 60% within 9 to 18 months. It depends on the quality of the fillers. There is a filler called Juvederm or Restylane, the life of which is about 2 years. But then there are Korean fillers, Chinese fillers, French fillers. Again, their life is little less, about 12 to 18 months. The most common complication of this procedure is nodule formation and some pain. This is Juvederm Voluma. Juvederm Voluma, which is a French filler, and it's one of the very popular fillers used in cosmetic surgeries across the world. Then the another one which I have shown is a mesoheel body filler. It is a Korean filler. The life of this filler is approximately 12 to 18 months, for whereas that of Juvederm is up to 2 to 5 years. In many cases, the filler has been found even at the end of 5 years. So I'm going to show some before and after pictures of girth enhancement with HA filler. There is a considerable increase in the size of the girth of the penis, as you can see from the pictures. So in some cases, the length can also be increased, but that is very, very rare, and if even if it happens, it's very insignificant. Uh, there is there are many doctors who advocate the practice of circumcision before injecting fillers, but I don't ask the patient to get circumcised, and we can safely do these fillers without doing circumcision. The central line which you see is a marker. We divide the whole penis into 4 quadrants so as to equally distribute the filler in all the quadrants. Now, this is another commonly performed procedure, which is girth enhancement with allograft. Allograft is acellular dermal matrix which is available in sheets, and it is acquired from donated skin using proprietary processing techniques. They preserve the biochemical and the structural components of the ECM. It is also used in burn wounds in reconstructive surgeries like breast reconstruction. Megaderm, alloderm are some trade names. Now, there is no donor site scarring because we don't take the graft from the patient. It is from the donated human skin. So there is no donor site scarring. The graft survival is very good. In my experience, it's 100% and very, very low complication. Pinopubic incision is my preferred technique. Some doctors also do circumcoronal incision, which is the incision around the corona of the glands. And the other one is pinopubic incision, which means the incision is at the base of the penis on the abdomen. So the penis is inverted out and the graft is placed between dartos and bucks. So whatever augmentation is happening, it is happening between these two layers, the bucks fascia and the dartos fascia. If you go down below the bucks fascia, you can go into the corpora. If you go above the dartos fascia, then you can damage the skin and it can lead to skin necrosis. Average girth increases by 2 to 3 centimeter and the length by 2 to 3, not 2 to 3, but I would say 1 to 2 centimeters. This is how it looks like. It comes in different sizes. Most commonly used size is 5 mm into 8 mm. These are few examples of before and after allograft girth enhancement. This patient came to me with hypogonadism, so I gave him TRT for 6 months. His penis size increased, the pubic hair developed, but he wanted more increase in the size. So I asked him to undergo the allograft operation, and he was quite happy with the post-operative result. This is again another case of the same. There is a considerable increase in the girth, and the appearance is also very smooth. This was a patient from Africa. He already had a very long penis and he wanted a girth enhancement, so I had to place 2 grafts vertically. I had to suture the graft and then place it between the dartos and the bucks fascia. If you can see, appreciate in the after picture, there is a incision at the base of the penis. So that is what I was talking about, penopubic incision. It's a very thin incision. It gets covered by hair, and after a few months, it gets totally disappeared. This is another technique which a lot of Korean doctors have been using. It's girth enhancement by PLA fillers. It's a collagen stimulator. It is made up of PLLA, polyDL lactide, a biocompatible and biodegradable substance. It naturally stimulates the skin cells to produce collagen. It is why Korean doctors have been using it commonly because of its immediate efficiency. It is safe, rapid, convenient, and quick. But in my experience, it is irreversible. If you have done it, and if the patient is not happy, or if the nodule formation has occurred, then you cannot reverse it. You can give him Kinocort injections into the nodule, but that will take about 4 to 6 months, and he has to come again and again for the injections. And that also, it doesn't resolve completely. It comes in vials, it comes in pellets. You have to inject about 20 cc of saline and make it a solution, and then inject this solution between the dartos and the buccal fascia. So again, before and after pictures of PLA fillers. As you can see, there is a considerable increase in the girth, but the only downside is that it is irreversible. And if the nodule formation happens, the patient has no other chance as to wait for another 2 years for it to dissolve. This is an obsolete method of girth enhancement with silicone. It refers to inserting silicone implants like silicone ring, which used to happen before in 1970s and 80s, when people would, when there was no concept of penile enlargement, and people still wanted a bigger penis, and they went to quacks and to beauticians and technicians, and they would inject a silicone ring, or patients themselves would inject a silicone ring sometimes into their penis underneath the skin. It results in post-operative inflammation and higher chances of infection and skin necrosis. Now, no commercially available silicone implants specifically for penile augmentation are available. Penile lengthening, again an obsolete procedure, and in my case it's a sham procedure because it doesn't really increase the size of the length of the penis. It refers to division of the suspensory ligaments with post-operative penile traction. Suprapubic incision is usually made. It does not actually lengthen, but it appears to be longer by 1.5 to 2 centimeters. In my experience, again, 1 centimeter gain is also very difficult to achieve, because it's very difficult for the patients to comply with penile traction for 6 months after surgery. So every day they have to put a penile traction device for about 4 to 6 hours. In fact, in some cases for a longer period of time, for the next 6 months after the surgery, which is not very compliant. Then this is a very invasive procedure devised by Perovic. This is actual penile lengthening by up to 5 centimeters, but again it can cause damage to the neurovascular bundle and glands numbness. This operation is not performed anymore. A few of the cases were done by Perovic in Serbia, but then they stopped it because of the complications. Another commonly available device in the market, in Indian market these days, as well as European and American market, is andropenis. FDA approved device. It can increase the length by 3 to 4 centimeter as per the claims. But I use this kind of this device and another device from another company. It doesn't really work. Patients are not happy with it, and it's very cumbersome to use. This is how it looks like. And you have to put it like that for about 6 to 9 hours every day. And you cannot put it in your sleep. You have to do it during the daytime when you are awake. So what is my 5-year experience of penile augmentation? So total cases in the last 5 years, I have done about 150 cases. HA fillers were 92, PLA fillers 27, allograft 28, and fat augmentation 3. Most commonly performed procedure was HA filler. As I said, it's non-surgical, reversible, adequate results, and at low cost. Higher satisfaction rate with allograft. So allograft has the highest satisfaction rate, and because of because of the high cost, this is not commonly performed. But if the patient asks for a permanent solution to penile augmentation, then you can offer him allograft. It is a permanent solution. The graft absorbs about 10 to 15% during the lifetime of the patient. So higher satisfaction rate with allograft, followed by HA fillers, followed by PLA, and followed by fat augmentation. Common complications: lump formation more in HA fillers because of the migration of the lump, or incorrect placement of the lump between the layers. And PLA filler, more common in PLA filler, HA fillers, PLA fillers, and fat augmentation. Lump was easily resolved with Hyalase in HA fillers, whereas in PLA fillers and fat augmentation needed to wait or undergo surgical removal. So that is the only downside of PLA fillers. Otherwise, PLA fillers can give fantastic results. Allograft, high satisfaction but difficult to procure in India. Most commonly used allograft is LNC Bioderm of South Korea. So recently, our institute did a first penile augmentation workshop in the world, and there were 20 doctors from across various specialities registered for the workshop. We performed 14 cases of penile enlargement during the 2 days of workshop. Various types of penile enlargement procedures were performed, like HA fillers, fat augmentation, PLA fillers, and allograft, and it was demonstrated to the participants. None of the patients developed any serious complications in follow-up, apart from minor side effects like pain at the procedure site. Thank you. Any questions?
Thank you, Dr. Chirag. I think we'll allow only one questions and we'll move on to the next.
Sure.
Because you are short of time.
Yes, sir. Depends on the procedure, sir. For HA fillers, about 2 to 3 weeks. For allograft, about 4 to 6 weeks.
Okay, thank you. Chirag, what is the cost of the treatment?
For HA fillers, it depends on the type of filler which you are using. The Korean fillers, they cost about 10 to 20,000 per 2 ml. So if you inject about 10 cc, so it goes to about 1 lakh, or more than 1 lakh, 1.2 lakhs. And for the allograft, it is about 2 to 2.5 lakhs.
Okay, thank you.
Yeah, please give big round of applause to